Hello, welcome to Grand Rounds. I'm very delighted to welcome a friend and colleague whom I've known for years. He's a pioneer in this area. Many of us are walking in his footsteps and trying to wear his big shoes is Dr. John McDougall.
It's been 55 years that I've been in the practice of medicine. I've seen over 12,000 people. I've touched them. I've talked to them. They've been my patients. And I'll tell you, I'm the luckiest doctor in the world. The reason I'm the luckiest doctor in the world is because my patients get well. You know, people don't like to be called fat, but what do I call people? Do I call them obese? I don't know that there's any nice term to use that makes people feel good about being overweight. Do you?
No.
I couldn't find a politically correct term, so I'll just use the best definition I can get. Fat is an adjective. Obese equates with fatness with disease. And overweight suggests there's an ideal weight. The reason I'm so fat is because of my natural traits. My laziness condemns me to being overweight. It's my fault that I'm obese. Maybe it's because my stomach is too big for my body. Or maybe it got stretched out through my years of overeating. You are to blame. There's something wrong with you, which is what we teach our patients. Maybe it's you got bad genes. After all, we do studies in experimental animals where we show that some rats and mice and other animals, they have certain genes that are very efficient, thrifty genes. Maybe your genes are the problem. Maybe the problem is you have an emotional or mental illness. You're a compulsive overeater. Blaming you, the patient, is wrong, not helpful. You're likely perfectly normal. If I were only a stronger person, I could solve my weight problems. You know what hunger is all about? I'd like you to think about doing an experiment with me, or one that I did in the past, to learn about hunger. What I'd like you to do, you might plan ahead. You don't want to do this if you're a child or if you're sick. What I'd like you to do is just stop eating for a weekend. Mary and I did this, 20, 30 years ago. Friday night didn't bother me at all. Saturday morning, I thought, gee, it's just a few hours, no big deal. By Saturday afternoon, I had no other troubles. I didn't have money problems. I didn't have spouse problems. I had no worries except for one, and that was eating, getting some food in. Sunday morning, I'd eat anything. I'd been a vegan for probably 20 years. I'd have probably eaten a piece of chicken or beef. I was so starving. Sunday afternoon, we got together as a group, and Mary made us a meal, a lentil stew, flatbread, rice, and a green lettuce salad. And for us, it was the best meal we ever had. This drive is huge. It's there to keep you alive. So let's start with the hunger drive, because that's where the whole focus of attention needs to be. And so Ansel Keys decided that he was going to do an experiment to study hunger. So he decided he was going to do an experiment. It was the Minnesota starvation experiment, done in Minnesota, of course. And what they did is they got 36 conscientious objectors. These were men who wanted to serve their country, but they didn't want to kill anybody. So they agreed to be part of this experiment, which lasted 11 months at the University of Minnesota. And what they did is they took these 36 conscientious objectors, and they found out how many calories and what their condition would be if they fed them a normal diet. So they started out for 3 months with about 300 calories a day. Then what they did is they asked these men to cut their calorie intake in half. So for 6 months, they were under a semi-starvation condition, half the calories they usually took, and as a result, they suffered from terrible hunger, horrible discomfort. And then they refed them during the last 2 months of the experiment. But this is what happened during 6 months of hunger. Food and eating became focal points in conversation. They read cookbooks, they dreamed, they had daydreams about food. They watched movies about food. They guarded their food at the table. They would finish their plate and they would lick the last crumb off their plate. They got very upset if, say, somebody was in the dining room who wasted food. And it never stopped. The pain never stopped. The interest never stopped. You can practice till you're 90 years old and you'll still have the same reaction to not eating enough food. So let's start with that very powerful hunger drive. Then what they did during the last couple of months is they refed them. And they allowed some of the men to eat as much as they wanted, anything they wanted. And they did something called the overshoot phenomena. They gained more weight than they started with. This is what happens when people starve in populations. Once the war or the famine's over and food is introduced, the starving population, because of the pain that they remember, they'll often overeat and gain excessive amount of weight, as some of these men did. All right, hunger is a blinding drive for survival. If hunger were easily denied, you'd become malnourished. That's what the truth is. Suppressing my hunger drives with diets and drugs is my best hope. That's what you think. Carbohydrates cause uncontrollable hunger. That's what you're told. Aren't you told that carbohydrates make you hungry? Mm-hmm. Anyway, we have a whole bunch of diets out there called the low-carb diets, the keto diets, the Atkins diet, the carnivore diet. There are doctors out there that are actually professing that you should eat an animal from the nose to the tail and every part in between. I'm serious. Anyway, when you follow this kind of diet, remember the men took in around 1,500 calories a day, half of what they were used to. If you drop the carbohydrate intake to around 50 grams, which is about 200 calories a day, you go into a condition called ketosis. Ketosis. You need to know about this, ketosis. Ketosis is what happens when you follow a low-carb diet. Ketosis is a normal, natural thing to occur in human beings when they undergo prolonged starvation, and they make yourself immediately sick. You lose water, like 6-8 pounds of water, and then you're sick. You lose your appetite. Anyway, if you look at the research, this is important for you to do. I want you to take the trouble to relook at this. This is 4 review studies on low-carb diets. What they did in these reviews is they looked at your risk of dying and dying of heart disease based on low-carb Atkins-type diets. Every single study published shows there's an increased risk of dying of heart disease and overall death from eating this kind of diet. And a recent study came out. You want to look this one up, 2023. What it said is that if you follow a low-carb diet, you have an increased risk of dying of heart disease, and dying of cancer. Just published a couple of months ago. You can starve and be in pain. You can go on these ketosis-producing diets, which Atkins recommended. And by the way, Atkins was a bit on the heavy side, to say the least. Or you can look to the pharmaceutical industry and look at drugs. And I won't talk about all the different kinds of drugs, but I just want to talk to you about the more important ones that you're hearing from every time you turn on the TV or radio or read something on a magazine. And that is the semaglutides, the GLP-1 agonists, glucagon-like peptide-1 agonists. This is what we're talking about in terms of Ozempic, Wegovy. There are about 6 different varieties of this, where you either take a shot once a day, twice a day, once a week, or they got pills now you can take. This medication is derived from the venom of a poisonous reptile called the Gila monster. This venom is as powerful as you get out of a rattlesnake. What they did is they took this venom. Maybe they observed what happens when you get bit by one of these Gila monsters. What happens? You throw up, you get nausea, vomiting, diarrhea. Hey, these are just like the symptoms for people who take these drugs. Well, they figured out how to make the nausea, vomiting, diarrhea last longer. And so they developed the medications from reptile poisons. There are all kinds of adverse effects. The desirable effects of this type of medication is nausea, vomiting, decreased appetite, constipation. They're trying to make you sick so you won't eat. They cause weight loss. You see it, the light gray line is a placebo. And the studies done, and all were paid for by the drug companies. Make you a little bit suspicious. At least you're going to look more carefully at the studies. All paid for by the drug companies. Oh, you see the weight loss in the light gray line. They put them on a 500-calorie reduction, so they did lose some weight, a little exercise. And you see the heavy dark line, which is the effect of giving these drugs. You see a considerable weight loss in terms of percent body weight. And they continue to lose weight until about week 68. And then they hit a plateau and they stop losing weight. The plateau is reached at an average weight loss of about 37 pounds. Mm-hmm. So you take this drug, which costs $1,000 a month, you end up losing 37 pounds, you spent $17,000, and you stop losing the weight. And if you stop the drug, you regain all the lost weight. You go to the average eatery, and this is what you find. Just like the dog and cat you feed table scraps to, what your children are being fed, what you're being fed is the wrong diet. Let's just leave it at that. Look, I go to IHOP. They fill the pancakes with cheese, make them 1,360 calories. Average a woman may burn 1,500 to 2,000 calories. A man, 1,800 calories. This is like one day's calorie intake. In one particular case, what they do is they feed various meals to people, low fat, medium fat, high fat, and we find out how much they would spontaneously eat in terms of calories. Well, in the high fat diet, they eat, almost 1,000 more calories a day. Okay, starches make me fat, so I avoid potatoes, rice, bread, and corn. Well, this is one of my favorite demonstrations, so pay attention. This represents the size of your stomach, each beaker. Okay, and what I'm going to do is I'm going to fill the beaker with 500 calories of various foods. And we'll talk about satisfying the hunger drive. If I fill the stomach with 500 calories of butter, on the left, you notice that there's hardly any filling going on in the stomach. It just covers the bottom of the stomach. If I feed them 500 calories of cheese, you see it fills up a third of the stomach. Meat, a third of the stomach. Rice, almost the whole stomach. Corn, the whole stomach. And potatoes, I can't even get enough potatoes in that stomach to meet 500 calories. See, because you've changed the density. But to get long-term satisfaction, you must eat what satisfies the hunger drive. And that's what we talked about the last 4 slides. What satisfies the hunger drive is sugar, carbohydrate. The McDougall diet caused me to gain weight. Some people say that. Well, what happens is if you've been dieting and you've been hungry, you might overshoot when food's available because the memory, the pain of hunger might cause you to overeat and lose a few pounds. But eventually, if you keep up with it, what's going to happen is your appetite will come in line and you'll lose weight effortlessly. We do a little variation of our program. We do something called the Maximum Weight Loss Program, which comes out of a book I published in 1984, which is still a national bestseller for Penguin. It's to tell you how to lose weight faster. I'm not going to go into that with you, but there are ways you can manipulate the starch-based diet to really, really eke out rapid weight loss. And this is with the Maximum Weight Loss Program. And also we do something called the McDougall Mini Diet, based upon the fact that if you eat monotonously, you will do better. Less variety is better. You eat the same thing for breakfast, lunch, and dinner. That's the way to regain your health. Not all this variety, 6,000 different products in the grocery store.
Well, that's great. I want to wrap it up here. This is a fantastic presentation, Dr. McDougall. I really appreciate it. Gained a lot. I appreciate the references. I made pictures of some of the slides. Look up some of those studies. Those are very impressive studies. And I want to thank the audience for coming on. I hope you guys got as much out of this as I did because it was a tremendous lecture. I always learned a lot, and we hope to invite you back.
Thank you, Dr. McDougall.
Thank you, everybody.
Okay.
Good night.
Bye-bye, guys.
Bye-bye.
Night.